right, you're gonna be so excited. I get to take your Foley catheter out, okay? You've done so good with it, but the doctor said we could go ahead and remove it, okay? So this is a whole lot easier than it going in, okay? Are you ready for me to take it out?
Yes, please.
All right, perfect. Okay, so here's a big thing I need from you. After I take this out, you got to let me know when you feel like you need to go to the bathroom, because we want to make sure that your bladder goes back to working like it needs to, and we're going to make sure that we can kind of get you to the bathroom when you need to go, okay? So I'm still going to be checking on you, making sure that you can go to the bathroom, but we can take this out, okay? So when I'm removing a Foley catheter, every hospital is a little bit different. Make sure that you go in. Most of them will have like a biohazard bag that you can empty the catheter in. Most often, I will make sure that this thing is not full of urine, okay, when you're gonna take it out. So I will always empty this bag, get all of the urine, document that, so that you have tabs on that, okay, because we're gonna be starting from scratch. So we wanna make sure that we have all of this documented, okay? So I'm gonna go ahead and make sure that that's been emptied, all right? I've got that all emptied. So we are gonna be ready to take that out, okay? All right, so I'm gonna move her bag, okay? Once again, you want to maintain privacy when you're doing a procedure like this. If there's someone in the room, you can maybe ask them to step out, because we're going to have to, okay, so I'm going to drape this back. I've got my bag that I'm going to be putting in. How many milliliters of fluid did we put in? We put in 10, right? So you want to make sure that you have an empty syringe. We want to make sure that we pull out 10. You want to make sure you get all 10 out when you're doing this, okay? So once again, it's the same as pulling in. I usually will tell them when I get all of the fluid out, okay? So we're going to go to the same place that we put the fluid in, okay? And pretend this doesn't have anything in, but I'm going to attach this, okay, right here. Attach this here, and then I'm going to pull out. You want to make sure that you pull out all 10, okay? I will even go beyond 10 to make sure that I've got every ounce of that out, okay? Because that would be very uncomfortable if somehow there's some retained in there, okay? Once I've got all that pulled out, all right, Miss Lindsay, I want you to bear down, okay? On the count of 3, we're going to bear down. I'm going to pull this out. Are you ready? 1, 2, 3. All right,
okay,
perfect.
thank you.
Okay, and I've got my bag. I put all that in the bag. Here's one thing to think about, okay? After you do that, if there is, sometimes when you're pulling it out, a little urine will spread. It may hit one of their legs. Make sure you got a clean towel in here. I always like to have a clean towel. Make sure they're all the way clean. When I've got this, I put this and dispose this in my bag. Okay, I've already had that emptied, and then I can recover them and maintain their privacy, okay? So that's the main thing. And what I mentioned to her is going to be really important. When you pull a Foley out, we're going to want to make sure that we want to know when she is able to go to the bathroom on her own, especially if it's been in for several days, okay? All right, you feel better?
I do.
Good. All right, well, that's out. So I'm going to be checking on you. Let me know when you need to go to the bathroom, okay?
I will.
All right.